Hello and welcome! This is Catherine from Double O Kidney. In this video, is it true that drinking coffee is harmful for your kidneys and can even cause kidney cancer? High calcium diet will cause kidney stone. Myth or reality? Men are twice at risk than women of getting a kidney cancer. True or false? And more. Let's start with the first one. Coffee is really bad for your kidneys and can cause kidney cancer. Myth or reality? Caffeine is a diuretic, a bladder irritant, causes a spike in blood pressure, and can have interactions with several prescription drugs. Used mostly as a mild stimulant, caffeine will affect the whole body, kidneys included, in several ways. A study shown that caffeine can actually worsen renal failure if kidney disease occurs in combination with metabolic syndrome. Excessive use of caffeine has also been linked to nervousness, insomnia, irritability, muscle tremors, and upset stomach. Should we stop drinking coffee and tea, then? Fact: caffeine is the most used drug in the world, and a large quantity of studies has been done about it. Researchers have found that if you drink caffeine in moderation, less than 3 cups of coffee a day, if you have normal kidney function, then caffeine won't do absolutely any harm to your kidneys. Coffee contains a wide range of antioxidants, at the point that the health benefits can easily overcome the possible problems. Caffeine may reduce the risk of liver, mouth and throat cancer by 50%. It has positive effects on the brain, may boost memory and reduce suicide risk. It also protects our body from cardiovascular disease, type 2 diabetes, both risk factors for CKD, stroke and Parkinson's disease. A review of 13 studies conducted on almost 800,000 people and published in the International Journal of Cancer showed that those who consume at least 3 cups of coffee a day had 16% less chance of developing kidney cancer. Number 2. High calcium diets cause kidney stones. This seems to be an easy one to guess, since the most common type of kidney stones are calcium oxalate stones. They must need calcium to form, right? A new study has even shown that people at risk of kidney stones shouldn't use calcium supplements. There are doctors prescribing low calcium diet to patients at risk of kidney stones. So, it is definitely not a myth that high calcium diets cause kidney stones. Or are we missing something? Fact: several researchers since the 1990s have shown people reducing their risk of getting stones by increasing the amount of calcium they get from food. This is due to the fact that calcium present in supplement, unlikely dietary calcium, it's not assumed with other nutrients, and our body cannot bind it with oxalate to excrete it. Oxalate is the main culprit for kidney stones, and we need calcium to remove it. So, what should you do to reduce risk of kidney stones? General consensus is you should drink a lot of fluids every day and cut back on sodium. Number 3. Men are twice at risk than women of getting a kidney cancer. Kidney cancer is ranked in the top 10 of most common cancers for both men and women. And there is a big difference in kidney cancer incidence between men and women. Mainly because women are usually seeking treatment earlier and following medical advices more thoroughly, researchers say. But is kidney cancer really twice as common for men than women? Fact: statistics from the American Cancer Society show that men are almost twice at risk than women of getting a kidney cancer. In 2017, there will be 64,000 new cases of kidney cancer. Of those, 40,600 will affect men and just 23,400 women. Doctors say that the key to survival is early detection and prevention of the risk factors. Symptoms to be aware of: low or high blood counts, pain in the low back or side, loss of appetite, fatigue, blood in the urine, unexplained weight loss, unexplained fever. Number 4. Kidney disease has unknown causes and cannot be prevented. This is a widespread misconception, at the point that even some doctors fall for it. While it is true that many times the cause of kidney disease cannot be tracked down, there are several risk factors to take into account. Taking care of the risk factors can prevent and slow down the progression of the disease. According to last statistics, in the US, 1 out of 5 adults with hypertension and 1 out of 3 adults with type 2 diabetes has CKD. High blood pressure and diabetes are the main risk factors for chronic kidney disease. Other treatable risk factors and causes of CKD include cardiovascular disease, obesity, smoking, some infections of the urinary tract, obstruction of the urinary tract. Understanding and treating appropriately these conditions is the way to prevent kidney disease. Maintaining a proper hydration, an active and healthy lifestyle is the true prevention of CKD and many other conditions. Regular checkups are helpful if you have familiar history of these conditions. This is all. If you like this video, please like and subscribe. Thank you for watching.